Welcome to this training video on home visiting safety. This training video is based on guidance from the Rhode Island Department of Health, the Rhode Island Executive Office of Health and Human Services, its affiliated agencies, and brought to you by the Rhode Island DMAT team and the Rhode Island National Guard. This video will describe how to appropriately don and doff personal protective equipment. Clients or household members may screen positive for COVID-19 symptoms. Some home-based services may not be able to be rescheduled, and some visits may be unannounced or emergency in nature. In these cases, the provider should prepare to wear full personal protective equipment, or PPE. We will review the best practices for proper PPE usage adapted from the CDC. These guidelines should be followed as closely as possible to ensure provider and client safety. As circumstances vary, especially in home-based settings, it may not be possible to follow the steps exactly. The provider should start by confirming that all PPE is present. Carry a brown bag with a gown, an N95 mask, 3 pairs of gloves, a surgical mask, and a face shield or eye protection. The N95 mask and face shield is reusable. The rest of the PPE should be disposed of after use. Donning is the process of putting on PPE. Ideally, PPE should be put on outside of the home prior to entry into the home. These steps include instructions for reusing an N95. Here are the steps for donning. Step 1. Perform hand hygiene using an alcohol-based hand sanitizer that contains at least 60% alcohol. Step 2, put on the gown. Tie or button in back. Coveralls may also be used. Step 3, put on 1 pair of gloves to handle your N95 face mask. Step 4, take the N95 mask out of the small brown paper storage bag and seat it over your face. Put the top strap over your head and bottom strap over the nape of your neck. Form the nose piece to your face and make sure your mask is seated correctly. Perform a seal check by breathing in and feeling your mask conform to your face. Do not wear makeup or sunscreen on your face while wearing your mask, as this can damage the mask. Men should be clean shaven to ensure an adequate seal. Step 5, take off your gloves, perform hand hygiene. Step 6, put on 2 pairs of gloves. The extra set is used for when we take off the PPE later. Step 7, apply a surgical mask over your N95 to limit contamination of your mask. Step 8, put on a face shield or eye protection. If unable to put on all PPE outside of the home, it is recommended that masks and eye protection be put on before entering the home. Alert persons within the home that the provider will be entering and ask them to move to a different room if possible, or keep a 6-foot distance in the same room. Once the entry area is clear, enter the home and put on a gown and gloves. Doffing is the process of removing PPE. Doffing should be done outside the home. Used PPE should go into a double-bagged plastic bag. Here are the steps to doff PPE. Step 1, perform hand hygiene on gloves. Step 2, remove your gown leaning forward. Pretend that you might have wet paint on the outside of your gown, and imagine trying not to get that wet paint on you. Remove your first set of gloves with this gown. Put the gown and first set of gloves in the trash. Step 3, perform hand hygiene on the remaining gloves. Step 4, remove the face shield or eye protection. Disinfect with wipes or spray, starting on the inside, moving to the outside. Put in your large brown bag. Step 5, remove your surgical mask by the ear loops and put in the trash. Step 6, perform hand hygiene on your gloves. Step 7, remove your N95 mask by the straps, placing in your small brown bag. Step 8, remove your gloves and discard. Step 9, perform hand hygiene. Dispose of used PPE in the client's trash can or place in the trunk of the car until it can be disposed. Perform hand hygiene. If unable to remove all PPE outside the home, it is preferred that masks and eye protection be removed after exiting the home. You may have questions about shoe coverings and shoes in this environment. Shoe covers are optional. If you would like to wear them, put them on as a last step in the donning process and take them off first in the doffing process. If you do not wear shoe covers, consider keeping a separate set of shoes in your trunk for occasions when you need to enter a home with PPE. Ideal shoes for this purpose slip on and off and can be wiped down with a disinfecting wipe. Providers should be attentive to cleaning and disinfection after the visit. Be aware that any items that enter the home should be cleaned and disinfected. This can be done with disinfectant wipes or spray. Be sure to review the contact time that is required by the product to ensure adequate disinfection. This can vary between 30 seconds to 10 minutes depending on the product. Minimize equipment entering the home. Minimize fabric bags and toys, as well as paper products that are difficult to disinfect. Providers should also clean and disinfect any high-touch surfaces, such as car doors, steering wheels, phones, pens, laptops,